All right, good morning, everyone. We are right at 11 o'clock, so I want to get started so that we can get to all the great content on this topic today and through a ton of the questions that have come through as well. Thanks for joining us today, Wednesday, May 20th, for this week's installment on our COVID-19 webinar and discussion series. Today's topic is Real Talk with Dr. Minns. Let me see if I can move that. Real Talk with Dr. Minns, separating fact from fiction, and our guest is Dr. Garold Minns, MD from KU Medical in Wichita. We'll start with just a few reminders about the program and a little bit of information about Kansas SHRM, and then we'll jump right into the program and finish up with Q&A. We've got a lot of great questions to get to, so I'm really looking forward to that. As a reminder, these sessions are being recorded so that those that can't be with us can access them at a later date. I've got a slide with some information about how to access those previous recordings from other programs that we've had. We've been doing this about a month and a half now, which seems crazy, but I'm glad that we're here and that we're still going on and covering new topics. As I mentioned, materials from this program and all of our previous programs are available on our website. This includes the recordings. It also includes the slides that typically have clickable links to various resources. One of our executive administrative team actually goes through and listens and records in writing all of the Q&A session that we do so that you can just go right to that if you need to reference an answer and maybe didn't have a chance to write it down on the live program. And then we also have handouts if there were any for the program. As far as recertification credit, this program has been pre-approved by SHRM for one PDC, and it has been submitted to HRCI for continuing education credits as well. If you are someone that needs HRCI credits, please email us at office@kshRM.com and we will get that to you as soon as we can. Typically takes just a little bit longer to get that response from HRCI. One other note about recording, I know I've mentioned it before, but YouTube does put a little selection of the videos on our recording. So if you don't want to be featured on our recording, please feel welcome to mute your video so that you don't show up. A Kansas SHRM overview. So if you are unfamiliar with Kansas SHRM, or maybe you're joining us for the first time, we represent all SHRM members in the state of Kansas. This includes anyone that is a national member of SHRM, and even those that are members of perhaps their local chapter, whether they are a national member or just a member of their local chapter, which is a great population as well. We do several events throughout the year, education opportunities. This is our first time doing kind of an online webinar series due to the pandemic, but we also have our annual conference every year in September, typically has anywhere from 500 to 600 or so attendees. We're working hard to plan for that right now. And then we have a legislative event in February and a student event in April. So there's a little bit of more information about us on the slide here, or you're welcome to visit our website and learn a little bit more. We are a volunteer-run organization. I'm serving this year and last year as the Kansas SHRM director. And then in my day job, I work at K-State as a manager for compensation and organizational effectiveness. And I've got my executive team here on the board. David Love is serving as our director-elect. He'll step into my shoes in January. Don't know how the time flies so fast. Our secretary-treasurer, Michaela Navarro, who's actually, we can thank her for securing our speaker for today. Thank you so much, Michaela. And then our past director, Shelby Smith. In addition to the 4 people you see on the screen, our Kansas SHRM board has about 30 people. We've got representatives from across the state of Kansas, some that are serving as chapter presidents in their local chapters, and then others that are leading core leadership areas like college relations or workforce readiness, governmental affairs, that kind of thing. So we've got a really great team, and all of us together, it's just a wonderful opportunity to network with HR peers across the state. So I encourage you, if you haven't yet, to reach out to your local chapter, get involved, and meet some of these wonderful folks. This slide is about our executive administrative team. These folks are also very, very amazing. They help us put on a lot of our events throughout the year. As I mentioned, they've been really key to this webinar series, both in securing speakers and also making sure that we're documenting all of the great insights that come out of it. You probably, if you're a member of your local chapter, you probably recognize Natalie Bright on the screen. She is our lobbyist in Topeka, and she also makes the rounds throughout the year to provide legislative updates to all of our local chapters. She is actually going to be on our call, our regular Friday call this week, speaking about the veto session that's happening tomorrow. So we're very fortunate to have all of these ladies on our team. I mentioned that you can access past programs. This is actually just a screenshot from the website to give you a preview of what it might look like if you went to check that out, and a listing of some of our previous topics. Those are live links, so when we share the slides after the program, you'll be able to click right through. The only upcoming program that we've identified at this point is on Friday, the Kansas veto session update. I know the slide says 11:30, but we're actually going to start at noon. And I'll make sure that that's updated on the slides that go out. You can register for that anytime, and we'll be getting an invitation to register out in email very soon. Okay, so that's kind of my spiel, and without further ado, I will turn it over to Dr. Garold Minns. Thank you again so much for joining us and sharing your insights and expertise.
Thank you, Jenny. Thank you all for participating today. I'm going to try and give you a brief overview of this virus and the disease it causes, and talk a little bit about what we see in the future and what we can do, how we're treating it, how we're trying to control its spread. I'll try to stay away from the political side, which it has become a political football, but I'm not an expert in politics, and I'll just stay away from that as much as I can. I don't think you all need to read this. It's not that important. So let's go to my, there we go. Oops. Okay. Well, there we go. Technology is great when you can figure it out. So most of what I'm going to tell you is about the medical side, and then we'll talk a little bit about its impact upon our society. So that's kind of a picture of what the coronavirus looks like. It's called coronavirus from the word crown, which means crown, and so it supposedly kind of looks like the crown with these little spikes all over it. I guess if you use your imagination, maybe it looks a little bit like a crown, but I don't think so. So I think it's important to stress how the world has changed in the last 100 years. As everyone knows, we're a global economy now. Our economy is not mainly based in the United States anymore. It's our economies throughout the world, and a lot of things are manufactured throughout the world that aren't manufactured here. So we not only have a global economy, but we also have a global health society. 100 years ago, most of the diseases and everything that we saw in the United States originated in the United States, were common to the United States, but no longer is that the case. And partly that's because of Wichita. As the air capital of the world, we have to bear some of the blame for the fact that we are now a global health society. And this is the problem right here, which we build a lot of the parts for. And unlike Las Vegas, what happens in China doesn't stay in China because of things like this that we have built and marketed. So in late December of 19, the Chinese reported to the world that they were witnessing a new infection that had started causing disease in their country in December of 19. And they had figured out that it was a virus infection. And after further genetic study, we learned that it was related to a family of viruses that we call coronavirus. Coronavirus is a non-specific term of a family of viruses that have caused mild infections in humans for years. It's a common cause of a chest cold that people get even in this country, and it's worldwide. There's at least 4 broad groups of coronaviruses that mainly cause mild infections in most people. It was determined that this was related to those viruses, but it was a brand new virus that we had never seen before. It came out of that family, but it's genetically distinct. Its technical name is SARS-CoV-2, and the disease it causes is termed COVID-19 after the year it was found.
Dr. Minns, we're having a little bit of trouble hearing you. Are you able to speak up a little bit?
I will certainly try.
Thank you.
So as I mentioned, coronavirus is a family of viruses that cause infections in humans, but also there are some varieties of coronaviruses that don't infect humans, but they infect other mammals and even occasionally various bird species. Most of the human strains prior to this time, not all, but most, have caused a mild respiratory illness we would often call a common cold or common chest cold. In general, the strains that cause infection in other animals species don't cause human infections because they're not able to attach to and enter the human respiratory cells. So a little bit about coronaviruses in general. These spikes have proteins on them that have unique shapes and forms, and they are able to infect other animals only if the shapes and forms on these spikes match up with the shapes and forms on the surface of the mammal that it infects. So think of it like this. These would be various proteins on the surfaces of cells in the mammal or the person. And the coronavirus, these spikes act like somewhat like a key. And if the key fits in the lock and can activate it, that allows it then to enter the cell of the host. So the proteins on animals are different than on humans. And therefore, for these coronaviruses to infect someone, the key has to fit, and the key in the animal viruses on the coronaviruses don't unlock the lock on humans, and likewise in the animals. The problem is if these other species of birds and mammals that are carrying one of their own coronaviruses are densely cohorted together in large numbers, mutant strains tend to develop. And if humans come in close contact with those mutant strains can occasionally jump. In other words, their key that normally fits an animal lock has mutated and changed its code to where it now matches up with human forms. This has been known to happen in the past. It's not a common occurrence, but it is not rare either. So if humans are in close contact with these densely cohorted animals where many mutant strains are popping up, occasionally one will cross over and be able to infect people. And we think that's what happened in China. Why China? Well, there's a journal that talks about what happened in China. And our current theory is that the markets in China do not look like Dillon's. The markets in China have raw meat hanging, and they often have cages under the tables with the live animals in them. And they brought them from their farms to the market, and then it's densely packed, you can see here, with people shopping, picking out either the meat on racks or actually taking the animals in cages to home to slaughter and cook themselves. So the theory is that there had been some mutant strains that mutated from normal animal coronaviruses to now having the ability to enter into human cells, and because of the dense cohorting of both animals and people, it was able to jump to some of these people. And once it jumped to them, then those people started spreading it to other humans. The current theory is it developed from coronaviruses that were in bats, and then it was able to jump from the bat to an animal called a pangolin. I wasn't aware what a pangolin is, but obviously, apparently in the Orient, it's a coveted animal that they often use for food. And this is what a pangolin looks like. I don't think these exist in the United States. We think it jumped from the bats to this organism, and then this organism. A lot of the people in China actually get these animals for their own food, and we think it jumped from the pangolins, then possibly into humans. That's the best theory. I want to digress just a moment and say a lot about this virus we don't understand yet because we had never seen this virus before December of 2019. We haven't had a lot of time to do a lot of research on it. So a lot of our knowledge of it right now is beginning knowledge, and there's a lot to learn about this virus. And I'm not going to tell you about pangolins because I don't know if that's really appropriate for today. We know that something similar to this has happened in the past. In 2002 and 2003, we had a mutant coronavirus that was able then to affect humans in China again. Again, we thought it came from bats and passed through simians to infect humans. This virus was much more lethal than previous mutant coronaviruses, and it had about a 15% mortality rate in the humans that it infected. Strangely, and we don't really understand why, this coronavirus just died out on its own, and we don't see it anymore. We're not really sure why it died out. Then in 2012, we had a mutant strain of coronavirus called the Middle Eastern respiratory virus that caused human disease in the Middle East, and its mortality rate was 35%, a very lethal virus. They're still seeing a few cases in the Middle East of this, but it's not as prevalent as it was when it first broke out. So my point is, these mutant viruses are not extremely rare, or they're not common, but they're not like they've never happened before. So this is the third SARS type virus that is mutated from the coronavirus family in animals to infect humans. This virus differs from these two in that it seems to be much more contagious than these two. It passes from human to human much easier than these two viruses did. And the mortality rate is much lower. It's fortunately not 35 or 15%, thank goodness. However, the fatality rate is higher than an influenza virus. So it's probably about 10 times more lethal than the common influenza that we see in this country. So as of May 18th, there have been more than 4,800,000 cases and over 300,000 deaths reported in the world. In the United States, we've had 1.5 million cases so far. And remember, we just started having cases in here in late January. And we didn't have cases in Kansas until middle of March. And so far, that's a fairly short time, but we've had 1.5 million cases, and we're now up to 90,000 deaths in the United States from this virus. That's a lot of deaths for a virus that just appeared here just over 4 months ago. In Kansas, we've had about 8,000 cases and 173 deaths so far. As you can see, most of the cases have been up in northeast Kansas in those 3 counties. We have cases here in Sedgwick and Lyons County. And recently, we've had a lot of cases in the southwest counties that have a lot of meat packing plants. So we've had about over 500 cases, actually a little bit more than 500 today. Johnson County's had 600, and Wyandotte has had over 1,000, as has Leavenworth. If you want to find out a lot more than I have time to tell you today, there's a really nice website at the CDC that you can click into, and it can tell you probably everything you want to know about coronavirus. So the virus is spreading rapidly for 2 reasons. It's a very contagious virus, and since we had never seen this virus in the United States, essentially nobody in the United States was immune to it. Unlike influenza. In influenza season, a good portion of the population is immune to the influenza virus because either they've had it in the previous year or they've taken the vaccine. So that's another reason why coronavirus has had a field day in the world, is because there was no humans that we know of that had much immunity to it. We've also learned that you can develop infection by someone who has the virus but doesn't even realize they're ill yet, or maybe will never become ill, and they can spread it to other people during their incubation period, or in some cases, some people don't even get sick enough they ever knew they had it. we think we have pretty good evidence it's spread by droplets from your respiratory tract. In medicine, we call these fairly sizable droplets because they're not microscopic. They're the kind of droplets you see if someone sneezes on a table and you see all the sneeze on the table. Those are the kind of droplets that have the virus, because this virus likes the respiratory tract of humans. The cells in the human respiratory tract is what it infects. So we mainly get this if we're near someone who has it and they sneeze or they cough, and we get those droplets on us and we inhale them, or as humans are prone to do, some person who has the virus in the respiratory tract scratches their nose or wipes their mouth from something on it after they ate, and then they either shake hands or they touch someone else or they touch their kids or whatever. So it's spread either by respiratory contact or hand contact. I don't know why humans have such bad allergies and such itchy noses, but there are lots of reasons we scratch our face. Sometimes we just have to because it's itching. A little bit about the disease that we've learned so far. The median age is age 50. So half the patients are less than 50, half are older. It tends to infect males more than females. We've known for a long time that females are the healthiest and the strongest of the species. 20% have a more severe illness, some requiring ICU care. About 10% of those that have the severe illness require time on the ventilator, and the death rate is ranged between 1% and 4%. I think it's closer to 1% than 4%. Interestingly, 80% of the people who get it have a relatively mild illness. They may have a fever in most of the patients. About 3/4 or more have a dry cough. And quite a few of us just feel kind of crummy, but that's pretty common with a lot of viral infections. So this is interesting. Most of us handle this virus fairly well. We're not sure why this 20% has much more trouble with this virus and gets much sicker. There are some studies showing the older population, that's pretty clear, the older population is more susceptible to have the severe form of the disease. And we also know if you have a lot of other chronic medical problems, you tend to be more susceptible to fall in this 20% that has a bigger problem with this virus. Younger adults and children, it seems less severe. Probably in a fair number of young adults and children, they don't have much of an illness at all. In China, the death rate was first around 4%, but after getting some more experience treating these patients, it dropped into this range, which is good. But again, it's much more lethal than influenza is. Again, partly because a lot of people are immune to influenza already, and we have a vaccine for it. Just to give you an idea, in China, if you were over 80 years of age, your mortality rate was 15%. If you're between 70 and 79, it was 8%. And it's not like it doesn't cause any severe illness in young people, it's just less likely. But still, there was a significant, I consider it significant death rate in even the 10 to 19-year age, but much less than the elderly and the near elderly. The older I get, the more I define near elderly. Well, what may happen? Well, back in March, the University of Nebraska made some best guesses based on what happened in China. And this is what they thought might happen in the United States if we replicated what China has. Unfortunately, it has been a little worse. But it hasn't played out yet. And if we work hard, we can probably prevent this many deaths in this country. But we're already up to almost 100,000 deaths, and we're still counting pretty rapidly. It's predicted that so far in this country, our predictions are similar to China, about a 6 to 19% hospitalization rate, depending on what city you're in. And so far, we've had 1.5 million cases in the United States. And that's a lot of cases in this short time period. At that time in March, they were suggesting that this would probably be 10 times worse than the worst flu season. And they were predicting once this illness plays out, this is not just a 3-month thing. This was a prediction for when we finally get on top of this virus, that we could have had 4.8 million admissions to the hospital and 2 million to the ICUs. We're trying real hard to make sure this doesn't come to pass. We don't want 500,000 deaths in this country. Because of the way this virus seems to have a higher lethality rate, and because in China, their hospitals were overwhelmed, their ICUs were packed. And in this country, in New York City, the hospitals were overwhelmed. The ICUs were packed. They didn't have enough beds for everybody. They didn't have enough ventilators for everybody. And that's what we're trying to prevent in this country. You could look at it and say, well, 80% of the patients don't get too sick with this. What's all the concern? Why are we having to do all this? Why are we shutting down the economy? Well, still, that 20% is pretty bad. And in New York, the hospitals were overcome because we had so many cases in such a short period of time. We think that New York and China were a little bit more likely to have those kind of outbreaks because they're much more densely populated, and there's much more likelihood you'll get infected with someone else. Think about New York. How do people get to work? Subways. If you've seen a subway, it's packed with people every morning and late afternoon. People are standing next to each other on the subways. They live in apartments that may be 50 stories high. They're riding elevators together. We are a much more spread out society. We, right or wrong, we travel to work mainly in cars by ourselves. So the likelihood of giving it to each other is less in the Midwest than it probably is in the large urban areas like New York and Chicago. Because they were overwhelmed in China, they had a severe shortage of protective equipment. They really had a rough time there. I mean, there's some theories out there that China purposely developed this virus and sent it to the rest of the world to dominate them. It seems a little odd that they would make so much death and illness in their own country if that was their plan, but I don't know. I don't know the truth in that. So far, though, the scientific evidence suggests it was not something they suspected, and it really developed in these markets, not in a laboratory. We're doing better now. When it first hit the United States, we were not prepared for it. We didn't have enough masks and gowns and gloves. Things are getting better. We also didn't have a lot of tests. China did share the virus with us and allowed us to develop a diagnostic test for it. So I got to give them credit for that. So we do have a very good test that measures the nucleic acid, the genetics of this virus, that allows us to diagnose the disease and tell if people are infected or not. Some tests are coming out to detect people who developed an antibody mainly after they got the infection. But those tests are not near as good as this test. The biggest problem we had in this country is we've had major problems getting enough numbers of the testing equipment. Just only in the last 2 weeks has Kansas had enough tests to even start testing as many people as we should. So what are the current recommendations as the year goes on? Well, we're recommending everybody needs to get the flu vaccine, because once flu season hits, it's going to be a mess trying to figure out if you got flu, you got COVID, or you got both. So we really were encouraging people to get the vaccine this year. We're trying to teach our healthcare providers what to look for. We're teaching them what the symptoms look like for this virus. We think we understand how it's spread. So we're trying to help the healthcare profession counsel society on how to keep themselves safe and not get this. We are encouraging our healthcare providers to take care of themselves. One of the problems they had in New York, because of the lack of protective equipment, a lot of the healthcare workers were getting sick, and that obviously made a problem for taking care of the patients. We've also had some trouble, even in Kansas, in a lot of our nursing homes. The staff is getting the virus, and then obviously when they can't come to work, who takes care of the patients? Some of our things we're telling people: if you come in contact with someone who has a proven case of it, you need to contact your provider, tell them about your symptoms, about your exposure. decide whether you need to be quarantined, find out if you're sick enough you need to see someone. Fortunately, a lot of the people who get the virus and their test is positive, they're well enough they can stay at home and they don't have to go to the hospital. If you're a resident in a community where person-to-person spread is occurring and you develop symptoms, even if you're not in contact with someone you know of, again, don't delay. Contact your provider. Most of the patients are not sick enough that they need to be hospitalized, but we do need to put them in quarantine so they're not giving it to other people until they get over it. Usually the quarantine period is about 14 days because the incubation period for this illness is about 6 to 7 to 8 days. So it would take that long before you would even know you have an infection and get sick. And some people, it takes up to 12 days before they get sick after they get the infection. Where a lot of cities, a lot of the counties, the state, as you know, are trying to develop plans on how to deal with this virus. We already have plans, and fortunately now we know how to deal with it. Now we're trying to figure out how to reopen the economy, and that's where we're at now. Remember, only 80% have a mild chest cold. If they do get the infection, if they get sick, they can pretty much stay at home. I know we're not all in Sedgwick County. I apologize for being Sedgwick County centric. We've had 537 cases, but I'll tell you about over 200 of those are people who've recovered and are doing well now. We've had 20 deaths, but I will tell you the death rate is much higher in Northeast Kansas and Johnson County and Wyandotte, and we're not sure why. We don't quite understand that. We have had 20 deaths in Sedgwick County, and all but 3 have been in nursing home patients. Again, emphasizing how the people with chronic illnesses and the elderly are much more susceptible to this. I think if we all just band together and be calm and follow the guidelines that are being made, that we can get through this. We don't expect a vaccine out until next year. We may get lucky this year and have the vaccine, but I doubt we'll have adequate numbers of the vaccine for everybody until probably early 2021. Even if they get a successful vaccine developed, it takes a while to develop all those doses. Currently, we have no tools to treat this condition or to prevent its spread other than social distancing, wearing masks, washing our hands, and trying to acknowledge how we transmit it from person to person and avoid those behaviors. Right now, our main tool to treat this and to prevent the spread of this virus is behavior change. The second tool we have is once we diagnose someone with it, we need to interview them, find out who their contacts are, and get their contacts in isolation so they're not giving other people unknowingly, not even knowing about it. We hope to have a third tool as soon as possible. They're working frantically on developing a vaccine. If we get lucky, we might have it this year, but most vaccines take longer than that to get developed. But I can tell you the scientific industry and the pharmaceutical industry is working on this much faster than they ever worked on any vaccine in the history of medicine. We don't have any antibiotics or antiviral drugs. There is a drug that they're testing now on the severely ill people, but we certainly don't have any oral drugs like we do for influenza. So that's why there's so much hype about this, is most of us are not immune. We don't have a drug to treat it with. And even though most of us will get by with a mild illness, there's a significant number of us who will have really bad outcomes. So that was the background. I've had a number of questions submitted to me. So Jenny, would you just like me to go through the questions?
Sure, that would be fine. Yeah, and we've got some coming in through chat. So when we get through the questions that you have in front of you, we can transition over to that.
Okay. So the first question is, we create a sick leave policy for this pandemic. Is that something we need to post and share with employees, or can we hold it for the time being? I'm not an expert in human resources, and I really think Jenny or someone else ought to be answering this question, but I do know that there's the Family First Coronavirus Response Act has been passed by the federal government. And I think if you meet those criteria for that act, you're supposed to inform your employees. But Jenny, do you want to comment on that?
This is a great question, and we've had on some of our previous programs employment attorneys who are able to comment a little bit more on this. I guess I would say I would direct you, since I am not an employment attorney, we do have those archived Q&A materials that I would direct you towards for that.
Sounds great. Okay, second question. I've seen different opinions of what to do about someone that's been exposed to someone with COVID. Some say a 14-day quarantine, others say monitor symptoms, stay home only if you are ill. If you've been contacted, what we recommend again is you probably should contact your provider, and I would recommend that you should be tested. If you're positive, you definitely need to be quarantined for the 14 days to see if you become ill and to keep you from transmitting. If you can't get tested, which nowadays you should be able to get tested, but if for some reason you couldn't get tested, I'd say you probably ought to stay in quarantine and take your temperature every day. If you start developing a fever or any other symptoms, you need to contact your provider. Next one, my son's friend's brother tested positive for COVID. My son works with his friend. His friend is getting tested. Should I stay home from work to be safe? Well, okay, so the friend tested positive, but we don't know if the son who works with the friend is positive. And I would say the son probably needs to get tested. If he's positive, then yes, the others who've been around him need to be tested. If the son is negative and doesn't develop symptoms in the next week or so, I'd say probably no one else needs to be worried about it. But your health department will help you with these kind of questions.
Okay. Yeah, I was going to ask a follow-up question. It's like that in-between time when you're waiting to discover if you're developing symptoms or if a test comes back positive. How do we handle that middle ground? Just be extra vigilant?
Extra vigilant, but I would say each case is a little different, so probably it needs an individual attention and probably should contact your health department because that's one of the roles they play is interviewing the contacts of the case, determining which ones really got a real exposure and some of the other ones it was not so much, and then give you advice. So it's hard to give a global suggestion. I would say anyone who's been in contact with a COVID patient should seek out their provider, and also if they need advice about should they be tested or whatever, they can also speak with their health department. Are there enough tests for everyone in Kansas? Well, there's not enough tests for everyone in Kansas, but we're getting better. And I know here in Sedgwick County, there was a while there we were only getting 30 tests a day, which is really anemic. And now we're up to over 200 tests a day that we're testing people. So it's getting better. It's not as good as we like it. Actually, Kansas has had one of the fewest supplies of tests in the nation. It's been a little, I don't know why. Is the CDC requiring all individuals scheduled for same-day procedures at a surgery center to be tested for COVID before they can have the procedure? I think that's an individual hospital determination. I don't think the CDC has come out and said that everybody. It kind of depends, well, what's your exposure? You know, there's some towns in Kansas that have not seen a single case. So I wouldn't think those people would have to be tested before they have a minor surgery. We're planning to open our community pool in a couple of weeks. Should lifeguards and patrons wear masks? Most of the time, the lifeguards are sitting up on the tower, and I think the likelihood of them giving it to anybody is pretty low. So, plus, I don't want them to drown if they jump into the pool. So I personally would not suggest that lifeguards wear masks. The nasal swab looks incredibly painful. Is it? Are there alternative options for testing youth? I would say the nasal swab is uncomfortable. I don't think it's pain people feel. They just feel kind of gaggy. Just feel yucky. If one cannot tolerate the nasal swab, the option would be to do an oral swab. It's not as likely to be testing positive as the nasal swab is. But if you just can't stand the nasal swab, I would do an oral swab. Should we all be wearing masks? I've heard that we shouldn't, to increase the timeline for herd immunity. This one's kind of a difficult question for me to answer. Some people propose that since 80% of the people have a mild infection, we should just let them go, everybody get infected, and then we're all immune. yeah, but you're going to have a lot of 20%ers who get really bad disease, and our hospitals are going to be overwhelmed. So that's what we were trying to prevent. You know, if you think about it, we weren't so much trying to prevent infection because most of the people, it's another cold, but we can't tell who's going to get the bad disease. And so we're trying to protect those people who will get really bad disease, and many of them will die. Even a few young kids will die. So that's the main thing we've been trying to prevent with this. We wish the 20% was 0%, in which case maybe herd immunity would be a good idea. But I don't think many of us want to get enough people infected that we have true herd immunity. You need to get up around 60% of the population or more to have good herd immunity. So yes, to me, a mask is a no-brainer. I know that a lot of people disagree with me, but it's wearing a mask is not painful. It doesn't, the cloth masks, I think are easy to breathe through. And we do think it, to some degree, limits your ability to spread it to others. So I would say, I wish everybody would wear a mask. I don't know why, even today in Sedgwick County, you go out and a lot of people aren't wearing them. I don't know if it's a image issue or maybe they're so proud of their appearance they don't want to hide it. I don't know. If it was Tom Cruise, I guess I could get that, but a lot of us aren't. I'm certainly not a Tom Cruise, so I'd gladly wear a mask. I want to hide my face. So yes, seriously, I just think people should just encourage others to wear a mask. It's such a simple thing.
Dr. Minns, I know you probably don't have a crystal ball, or if you do, I would love to borrow it. But when we're thinking about masks and wearing them, do you have any idea, or I don't know, can you give us some idea of how long you think the mask thing will be something that we have to think about?
So that gets down to what I think is going to happen in the next 6 months. I have no reason to think that we're going to get enough people infected to have herd immunity. I have no reason to think this virus is going to just vanish like SARS did. I hope it does, but so far it doesn't seem to be vanishing.
Just one?
So I would say we won't have a vaccine, and I doubt we'll have any treatments by the end of December. That if we have vaccines, I don't think there'll be enough produced at that time to give everybody a vaccine. So I think we're all going to have to learn how to deal with this probably for the next 6 to 7 months. I hope we have a vaccine early 2021. In that sense, I think if we can all just do the social distancing and make that a habit for the time being, wear masks, keep our hands clean, I think we can keep this infection, this disease rate low enough that it's not causing our hospitals to be overwhelmed. But I don't think it's going to be zero. I hope I'm wrong. I hope it vanishes by August, just like SARS did. Most of the people I read about don't think that's likely. Nor should I put it this way, I think we should plan for it not vanishing rather than hoping and assuming it's going to vanish.
Sure, thank you.
Hydroxychloroquine, that is pure theory, and they're doing studies on it now. I think if you want to enter a study so we can really learn whether it works or not, that's fine. Hydrochloroquine is a fairly safe drug, but it does cause serious heart problems in some people. So it's like all meds. You shouldn't take it unless you know it's really going to benefit you. And right now, we don't have any evidence that hydroxychloroquine benefits people with this virus. Team sports, should my child participate? No, I guess it depends on the sport. Is it a sport where there's a lot of person-to-person contact? Might have to question that. If your child has any underlying conditions, I would seriously question whether they should take a pause this year. I've heard that eating a lot of fruit will stave it off. I don't know that there's any evidence that what you eat determines whether you'll get it or not. We have a patient who has an incurable disease. Everyone thinks he should not be at work. He refuses to wear a mask. Are we liable if he gets COVID? I don't think so, but again, I'm not an attorney. I know there's some discussion in Congress about giving some liability protections for things like this. So that's all I can say about that. Have we successfully flattened the curve? We certainly have flattened it in Kansas. New York, they let it get out of hand and they had a real peak. Now it's coming down, but it's certainly, their peak was not flat. I think we've been lucky in Kansas. Our cases for the most part have been more like a flat curve. Although I will say in Dodge City, they had a peak. It got away from them. What resource should we be listening to? Boy, that's a tough one. I don't want to advertise any particular outlets. You should listen to your health department. You should listen to the CDC. You should listen to your physicians. Unfortunately, there's a lot of stuff on the news programs that they really show the worst case. They find the most sensational thing to show. How many newscasts have you seen? Well, here's a guy, he's part of that 80% and he feels fine. That doesn't sell news, that doesn't sell commercials. So I'm a little reluctant to listen to the programs on those TVs. Why did the CDC originally say no mask? Now they say yes. What changed? We're learning more about this virus as we go. We were completely in the dark about this. None of us knew. As we go on, we're trying to learn more and more than we can. And I think some evidence came out that the masks do help. They're not 100% protective, but they do help. I've been watching Plandemic on YouTube. Is this for real? I don't know. I've not seen Plandemic. Someone asked me about the effect of defunding WHO. That's kind of getting into a political discussion. I'm not an expert on WHO. I do think some people think it's a little unfortunate because they think WHO is one of our resources to try and worldwide get this thing under control. But our state and federal legislatures sure like to tell us what to do right now. We've implemented a lot of things at some cost. Are they right? Well, it depends on which agency you're talking about. I would just say in general, I think CDC is trying to do its best job to help us get through this and protect ourselves. So I do think the CDC recommendations are something we should take to heart. My family wants to have a birthday party this Saturday, 30 family members. If we space them out, would that work? Again, a lot of things we're recommending now, we don't have hard proof. We think it makes sense. I think if you had a birthday party, depends on the age of the kids. How much can you counsel the kids and how much are they likely? If they're 5-year-olds, probably you're not going to be very successful in any social distancing. Again, depends on what county you're in and how many infections they've had. If you're a county that's not seen a case of COVID virus, maybe it's okay. But I'd say if you're in Ford County, I would avoid any birthday parties for this time being until it gets under control. There's a lot of cases in Ford County. And I hope anybody from Ford County doesn't say I'm talking negative about it. I'm not. They just have a lot of cases and they're trying to get it under control. I work in an office. I come into limited contact with coworkers and an occasional customer. Do I need to strip, wash with scalding hot water, and wash my clothing? No. I don't think you need to do that. I know some of the healthcare workers that are working in the ICUs all day with these patients. I do know that they're doing that. They're changing their clothes in a workroom and they're taking a shower before they go in with their family. I think that's okay for them, but not for people working in office buildings and don't even know if they have any cases. How long can it serve on how the virus live on surfaces? There's emerging research showing that it probably can live on plastic for maybe 2 or 3 days, but we don't know whether that virus is healthy enough to infect you. We know that on paper, it doesn't seem to survive over 48 hours, 24 hours. Don't know why paper is less hospitable than plastic is. My box is pretty lax about this. We haven't implemented any protocols. Do you encourage social distancing? Yes. We haven't had masks. I personally think masks are fairly innocuous. They don't hurt. It's not going to be 100% protective, but it's better than nothing. Can you use too much hand sanitizer? Well, I think it's like most things in life. Yes, you could use too much. I don't know what that too much is. I would say I wouldn't only use hand sanitizer. I would wash my hands 2 or 3 times a day in addition to hand sanitizer. What is the proper percentage of alcohol for effective hand sanitizer? What I've read is if you're talking about ethanol, it's about 60 to 70% ethanol. Does Everclear really work? I assume Everclear is 100%, so yeah, I think it would work. But How do we get employees to stop watching YouTube, Facebook, and TikTok? I think that's a human resources question. I have no insight on how to get people to change. Yes, they are letting some prisoners out that had low-level crimes and they were getting near their release date anyhow. They are letting them out because they've had severe overcrowding and we've had some outbreaks in prisons. I already talked about what my prediction is for 2020. Are we going to quarantine every new virus? No, not every new virus is lethal. Most viruses aren't lethal, and most viruses aren't this contagious. So this is an unusual virus. How far are we of getting a new vaccine? I think it's 2021, but we might be lucky. Yes, if we do get a vaccine, it's going to be probably like the flu shot. Can the government mandate everyone get a vaccine? I'm not aware that the government can do that. They can certainly recommend it. They can certainly provide funding for it, but I don't think they can mandate it. Yes, COVID is worse than the flu in terms of percentage of deaths. What this says, you mentioned in a meeting, I think it was Sedgwick County Commission, that economical fallout from this virus was going to be worse than the virus itself. Do you still think this is true? I don't recall saying that, and if I did, I maybe misspoke. I think I would have said, we need to be smart about this. And if we're not smart and it does get out of control like it did in New York, then we're going to have to shut down everything, and that will be very severe economic damage. I think if we be sensible, do the simple things, wear masks, wash our hands, social distancing, I think we can have it both ways. Keep the virus under control and still be at work. That's all I have. Do you have some, Jenny, that you wanted to ask?
I do. So there's a question about the second round. You know, we've heard a lot about that. What is your feeling on whether there will be a second round? And would that be different than what we're currently experiencing?
I think the fear is that if people don't do the behavioral changes we've talked about, as we let people go back to work, and now they're interacting with other people more often, the curves could start to rise again. I think the other concern is we know that the kids are out of school now. Mm-hmm. Some of the success we've had may be from the fact that we dismissed the schools. Now, why am I picking on the schools? Most kids don't get very ill from this, but kids have a hard time washing their hands, social distancing, keeping their fingers out of their mouth, out of their nose. And so kids are very good spreaders of virus, all viruses. You've had kids, you know that you're in for a lot of colds. So our fear is if school gets back in session and the virus is still floating around and the kids start spreading it and bring it back home, we could see a lot more adult cases, and then the hospitals will fill back up. So I think that's a big question people are struggling with right now. And how can we reinstitute school and keep the spread as minimal as possible? But when school resumes, as we reopen the economy, if people can't find it within their willingness to cooperate with the social distancing, probably the case number will start going up again. Mm-hmm. We sure hope that doesn't happen.
Yeah. So, and I apologize if I missed you answering this one, but there was a question about what are your thoughts on whether we need to sanitize our groceries?
I have relatives that only one adult in the family goes to get the groceries. The groceries are brought into the garage. Some of them sit in the garage for 2 days. And then they wipe them down with a wipe before they bring them in the house. I'm not criticizing my family member, but I don't think there's any science out there that says that's necessary. And I don't wipe down my groceries. Obviously, our fruit and vegetables we wash before we prepare them. I don't know of any evidence that canned goods and things like that have transmitted the virus.
Mm-hmm. Okay. So I want to go back for just a second to the question about Plandemic on YouTube. I have also not watched it, but I think it speaks to this line we're trying to walk where everybody's saying that they're legitimate and that they're a credible resource. This lady's a doctor, so she must be for real. How do we figure out who we can trust? loaded question. I'm sure it has an easy answer.
Well, I would say anybody who's on a social media or a TV that has something to gain by saying a certain thing, like they're getting paid to say it or they're helping sell commercials, I think I'd be very skeptical. You have your local provider, you have your health department. I think the CDC website is very informative and very fair. I frankly think that a lot of these hired guns that they get to talk on these news programs, you gotta take a grain of salt. There's something in it for them to do that. They're being paid to do that. I hate to sound so cynical.
I think that's helpful though, and you mentioned during your presentation, or maybe it was during the questions, to always go back to your county health department, you know, and the CDC and some of these resources, I guess, that are consistently credible and at least working off the most current information. Because as you mentioned, we're learning about this all the time, and so yes, sometimes information changes, but those are necessary pivots for when we learn something new.
I agree.
So I think that's helpful. Thank you. You mentioned in your presentation a few comparisons to influenza, and I know I've heard this before too. There are folks out there that are like, this is just the flu version 2. Why are we getting so exercised about it? But you pointed out that there is a higher mortality rate. And even though if we have people that are trying to compare number of cases, that they're not necessarily comparing the number of cases on the same time frame. So I guess just would you reiterate some of those really key distinctions and how this is not the flu? This is
two other main factors. We have vaccines for flu. If you take your vaccine, you may still get it, but it would be a milder illness. We don't have a vaccine for this yet. We have medications that we can give you that will kill the virus. We don't have any medications. Maybe someday we will, but we haven't had long enough time to figure out what those chemicals are that will kill this virus. So two main differences. We have much greater immunity in this country to influenza than we have for coronavirus, and we have medications to treat it with that we don't have for coronavirus.
Can you speak to kind of returning to work after being ill? Typically we hear 24 hours fever-free. What's the new guidance on that?
Current guidance is that you should not, if you've had COVID virus, your test is positive, whether it's a mild illness or a severe illness, you should not return to society until 10 days after the start of symptoms or 3 days after the symptoms are completely gone, whichever is longest. And obviously, you may have other health conditions and you need to consult with your provider in that case.
I've heard from some people that there may be people that have a genetic immunity to coronavirus. Is there a scientific basis for that?
Not that I'm aware of.
Okay. What is your feeling on swimming pools and opening them up?
I'm not negative about opening up the swimming pools. In the pool itself, it dilutes out most of the bacteria and stuff. I think, though, you do need to make sure that you don't have a group of 10 kids all bunching up on the concrete, hitting each other and potentially transmitting. But I think if they use good judgment, I don't find the pool all that objectionable.
Okay. Can you talk a little bit about tracing efforts and what that looks like? Are we really able to show where cases are originating from through those efforts?
Well, we're working very hard at it. The health departments throughout the state and other states have hired a lot more tracers. I know in Sedgwick County, we've hired a lot more tracers and trained them. So every positive case is interviewed by that tracer. We find out who their recent contacts have been, and then we reach out to all those contacts, try to find out whether they are ill, and we also offer testing of them. So that's one of the main, I didn't mention that, that's one of the other major tools is try to identify anyone else who's gotten infected before they give it to other people.
Mm-hmm. Thank you. We had a question about recertification credit. So I've got the SHRM information up on the screen. If you're waiting for HRCI, we're going to be getting that within hopefully the next couple days, so do reach out to us. I just have one other question that has come through, so if you were waiting to send yours, please send it now before we end. This question is just about doctor's notes. We've had previous folks on these programs that have said, you know, you're really going to cause a kink in the system if you start requiring everybody to have doctor's notes. What are your feeling on those?
You mean return to work notes?
Uh-huh. Yep.
Talking about? So we're assuming that I don't want to answer this without addressing some of the assumptions. It's assuming it's someone that got infected, they had an illness, they're beyond that 10-day, 3-day time limit, and now they want to go back to work.
Mm-hmm.
And
Yeah.
so the employer's asking, what do I need to make sure that they're telling us the truth?
Right. How do I verify if they've had COVID or something else?
Well, I think that kind of gets back to a human resources question. Do you feel like to protect yourself that you need to know that a provider has said, yes, they've met those criteria and they did have COVID, they didn't have something else? So I don't know, as a provider, I'm happy to give that note. I guess whether you need to require it or not, it's kind of a human resources question as opposed to a medical question.
Okay.
I hate to bail on some of your questions, but I don't think it's a medical question.
Sure. Well, and I think what makes some of this so tricky is that we're all navigating it for the first time. So no one has like this global answer that applies in every situation. So we're really being tested, I think, to do the best we can with the information that we have and kind of manage risk as we're able to. I know we had that question about, should I have this birthday party with 30 people? I mean, we've all been quarantining, right, for 8 weeks, so it's probably fine. Well, and I've asked myself this question, you know, my friend's inviting me over, how bad could it be? But, you know, in my case, I'm asking myself, sure, I can take this risk. It's a calculated risk. What happens if it doesn't work out though? And then what happens if I give it to someone that I love or someone that I know and they get really sick from it? Was it worth it? You know, so I don't know if there's a right or wrong answer, but it's kind of a risk mitigation.
I think what was a wake-up call for a lot of the healthcare providers was the fact that we discovered that people are completely asymptomatic and transmit this virus. They don't even know they have it. And that, I mean, I think people think, well, if I see someone who's coughing or looks like they're sick, I'll avoid them and we'll be okay. Not at this virus. Why it can be asymptomatic in some and lethal in others, we don't know.
Yeah, absolutely. Definitely ever changing. Well, that is the end of our questions. So thank you so much, Dr. Minns, for joining us. I really appreciate kind of those foundational facts that you shared with us about the virus and your time in going through all of these questions. I think this is really helpful. And I feel like even as things continue to change, we all have a little bit more of a compass in a way to navigate through all the various different pieces of information and guidance that we're getting. So thank you very much.
Thank you. It's my pleasure. And I hope people felt they got some of their questions answered.
Absolutely. Absolutely. And thank you, Michaela, for connecting us with Dr. Minns. This has been wonderful. I've got the certification information up on the screen. We'll have a follow-up email with the recording and slides and a brief survey. So if you want to fill that out, that would be wonderful. We will be in touch soon about Friday's programs and anything that you can expect from us next week. In the meantime, enjoy the rest of your Wednesday. Thank you.